We're really happy to have a couple guests with us today. We have Geraldine Vance, the CEO of the British Columbia Pharmacy Association, and David Pavan, the Deputy Registrar of the College of Pharmacists. So welcome to the two of you, and thank you for taking the time.
Thank you, Derek.
Happy to be here.
We want to talk today, I think, a little bit about the relationship, first of all, between the association and the college. And I know, David, we've had you on in the past and talked about the role of the college, and hopefully that's provided some clarity for pharmacists that are watching the podcast or listening to our podcast. But how have we arrived at what you see as, and what I see as a member of the profession, as what I think is a pretty good relationship between the college and the association now, in terms of working together to try to move the profession forward, given that, you know, the college's role is really to protect the public and the association's is to advocate for the profession?
I think from the perspective of pharmacists, good practice makes for good patient care. So in an ideal circumstance, and generally speaking, there isn't a conflict between either the association or our members and the college. Because if pharmacists do the job that they are trained to do and want to do and should do, they shouldn't end up in conflict. So most of the time, our members are not in conflict with the college.
I would agree, and I think, you know, recently we've partnered with the association on a couple of key initiatives. You know, the first being the pharmacy manager training program that the association developed and the college has made mandatory for all pharmacy managers to take. And the second is the opioid agonist training program. Yes. That was a collaborative effort by the college, the association, the ministry, the BC Centre for Substance Use, and other stakeholders. And I think those two are perfect examples of how, you know, our organizations can work together and move the profession forward and help in each of our mandates, you know, ours as to protect the public and the association as advocacy.
So with that in mind, we know that the college has done, I think from my perspective at least, some advocacy work in trying to advance the scope of practice for pharmacy. So how does the association feel about what the college has done? And in particular, we're talking about pharmacist prescribing initiatives, and I guess from David, from your perspective, why has the college tried to move that forward in its role as a protector of the public?
Yeah, so I think that initiative that was put forward by our board was for patient safety. It was kind of how they approached it. You know, when I look at the healthcare system and we all understand the demographics of our society and the aging population and the strains they're putting on our healthcare system, I think there's a role for all healthcare providers to have an expanded scope of practice. We've seen that in the nursing profession. And I think, you know, each of our organizations plays a role, from the educational institutions to the advocacy bodies to the regulators, in trying to meet the needs of the population as they age and as we try and care for them. And I think we all have to work together to advance our individual initiatives in order to ensure that there's safe and effective patient care in all aspects of healthcare.
That makes sense, but, you know, Geraldine, did the association feel like the college was stepping on your toes when they did that?
I think the association certainly welcomes the support of the college in general terms, in terms of supporting the advocacy, the moving forward of the profession, right, for sure. The specifics, one might, you know, disagree with the specifics, but at the end of the day, the association's role and responsibility, and all pharmacists and pharmacy owners have the responsibility to demonstrate to government and to other payers that using pharmacists in a more robust fashion makes sense. That's really what our job is. So does that end up in a team-based care, as we're seeing in some situations in the new centers? Is it about individual prescribing in pharmacies? In some instances, it's probably a mix of things. Having the college generally supportive and acknowledging that pharmacists are trained in a way to take on additional responsibility, that makes sense. But at the end of the day, we need to convince this administration or others that it makes sense to support the better use of pharmacists.
I guess that makes sense to me as a member of the profession, as a registrant of the college, and a member of the association as well. And you know, I hope that other pharmacists can sort of understand that. One of the issues that I hear from a lot of my colleagues in the profession oftentimes is that I guess it's not an issue, but it's a lack of understanding on the part of the profession about how advocacy really works, and why does it take so long to try to get something done with government? Can you speak to that from the association's perspective?
I guess I'll take a step back in my consulting days when I used to work with clients and help them with their government relations, right? And I used to always start by saying, there is no risk for a government to say no. And there's a host of risk associated with saying yes. So staying in the status quo represents kind of no political risk, right? So you better go there with an argument that makes sense to government about why they should step out of that comfort zone and go to a different position, right? I think pharmacists have failed to do that, and the association is in a comprehensive way that has had, now 2 different administrations say, yeah, we understand, we appreciate, and we're going to mobilize those people that are out there in those, multitude of communities. But we need to start by understanding that first and foremost, any minister of health is going to say, tell me why I should do something differently and why it makes sense to me and the agenda of our government. And that takes time.
Yeah, and so I guess to that point, I wonder about what role the association and the college could play in trying to educate the members of the profession a little bit more about understanding how advocacy works, so that they don't have unrealistic expectations about how long it's going to take to get this done. And I'm going to relate to you a story. I was recently at an event at UBC speaking to a number of pharmacy students, and a lot of them, were saying to me, well, why doesn't the association just go and tell the health minister that we need prescribing privileges and we can just start doing that right away? And they just clearly, so because that was a student event, I guess another part of my question is the faculty and the university, do they own some of the responsibility here for misguiding students about expectations?
Well, I like to think that if we were to hearken back to our student days, I'll go back to my days a long time ago in journalism.
You see how
school.
great my hair is, Geraldine?
That those times are very aspirational times, right? When you're a student and you're freshly trained and you're learning new things, you better want to conquer the world. Because where are you going to be 10 years out or 20 years out or 30 years out? So that enthusiasm that students have for wanting to do more, I would always welcome. It is our job to try and educate them and others in what the process is like. And I think if you think about any time that you've dealt with a large organization, you don't pick up the phone and say, boy, I'd like this to happen, and have them say, whoever they are, whether, whatever the organization, oh yeah, we'll make that happen tomorrow, right? If you think about the decisions that a government is making in the context of other encounters that we all have with large organizations, things don't happen overnight. But that enthusiasm, we should welcome.
Yeah, fair enough. Makes me think of some of these shows you see on television where you graduate from high school and you're the CEO in the next year, not reality.
Yeah.
And I don't think that misunderstanding is just at the student level.
Oh, for sure not.
Yeah.
For sure not.
We have many registrants that don't fully understand the process, and the process is involved in changing simple legislation, and how long that actually takes, to change something in the Health Professions Act or in the Pharmacy Operations and Drug Scheduling Act. It is very, very time consuming, and it's fast if it's done in a year and a half, and that's with everybody in agreement. When you have differing opinions, it's a much longer process.
But I think the responsibility also lies on the individual day-to-day engagement that a pharmacist has with their patient. You never know who that patient is, and we've seen situations.
Yes.
So, are you using every opportunity every day in every patient encounter to demonstrate that they should have confidence and high regard for what you're doing? Because if you're not, you don't know who's showing up at your pharmacy and who that might be and how long that influence of a bad experience is. So it's up to pharmacists to show all of their patients, which includes ministers of health, premiers, and others, that they deserve the regard and respect for the professional job that they do and can be entrusted to do more.
I 100% agree with that, but I'm going to challenge you with what I think a lot of pharmacists would say if you said that to them, and they would say, I don't get the support I need from my employer. I don't have the time or the resources to perform like that with every single patient that's in front of me every day. And I'm being pushed to do other things and meet certain, key performance indicators. And so I can't do that. Is that a valid excuse?
I'm going to say I think it's at least a little bit of a cop-out. I recall distinctly, and this relates to the opioid agonist training, going into a very, very busy pharmacy and watching this pharmacist interact with a patient who was coming to get his daily methadone. And that pharmacist did all of the things that the college required of that pharmacist to do in terms of checking, is that person not high and able to receive their methadone, and checking their address and checking in with them in general in a very small, it did not take a lot of time.
Yeah.
But did they connect with that patient? Did they do all of the things that they were required to do? Yes. So I don't think it is always a matter of I need more time, I need more something, right?
Right. Yeah. Any comments around that issue, David?
Yeah, the issue does come up. We hear it. We hear there's pressures on community pharmacists to do more with less. Labor's being cut. They're asked to do medication reviews, immunizations, adaptations, and we hear that. And I would agree with Geraldine. I think it's a bit of a cop-out as well. I think you as a healthcare professional, you have a responsibility, and you need to stand up for that. And, it's difficult, it's hard to do that sometimes, but you need to put your profession and your ethics first. And I think, we need more pharmacists to start standing up and say, hey, this is not the right thing to do.
Yeah. And if they're in an environment where they can't perform to the best of their abilities, maybe they should be looking for another environment in which to practice.
Talking to their employer. We too, from time to time, get calls saying, well, you need to tell my boss I can't do this. You need to tell my boss, right?
Yeah.
No, you need to get into a conversation if you really think that your ability to meet your professional and patient obligations are being compromised. Have that conversation, right?
Well, for sure. I certainly agree that pharmacists need to take a little bit more control about their own long-term goals and their own career path with regards to their employment situation, for sure. And stand up for those things that they know are the right things to do, and the required things to do by law, for sure.
And I think to a certain extent, pharmacists are their own worst enemy. We set expectations for patients to get their prescriptions in 5 minutes or 10 minutes. And if they have to wait 15 or 20 minutes, they start complaining. Yet they've come from a doctor's office where they waited an hour and a half, and that's not a problem.
Yeah.
And so, there's a bit of a disconnect there for me. You have to provide a certain level of care and meet certain requirements. And if it takes you 30 minutes, it should take you 30 minutes. And, I think as a profession, we need to start to reassess on how we're practicing.
Geraldine, from the association's perspective, how, you are in a unique position in BC with the association versus other provinces in terms of how your membership is structured, and you have members that are both general members, which are individual pharmacists, as well as corporate members, which are,
they're employers.
They're employers for the most part, or they're pharmacies.
Yeah.
So, how do you balance trying to represent both of those groups when oftentimes the interests of them are not really in line with one another?
Well, I'm not sure that I would agree that they're not in line. I think that, pharmacy services have been delivered in this model for as long as you and I know about. And in terms of, you have privately owned pharmacies delivering services that are in part paid for by the public payer, right? That has not changed.
Right.
As the pressures increase, the luxury of the employee to not worry, you think about, how their employer's business is doing, has decreased a bit, right? I mean, we all know that times are challenging, but really it has never changed in the sense of the model. And so I think that our association is well positioned because you cannot have a pharmacy professional working, a pharmacist working, unless they're working in a private pharmacy. So there is no ability to kind of separate the two. And so I think the model that we have, I had nothing to do with the creation of that, really acknowledges that they're coupled pieces, right? There should not be, and shouldn't be a separation of the two.
I personally agree with that, but I think the frustration with a lot of staff pharmacists that are working for an employer is they're disconnected from the fact that the success of the business itself, particularly from a financial perspective, is going to reflect on the success of them as an individual pharmacist, because the less successful the business is, the less resources the owner, for example, the employer will have to be able to commit to having that pharmacist provide optimal care, right?
And I've heard you make that argument to pharmacists often, and it's one that needs to be remembered. The ability of the pharmacy to attract and keep more patients in a highly competitive time relies on that relationship that pharmacist creates with their patients. I went to my pharmacist last week, having come back from my vacation with a blown out knee, and my husband subsequently went to get some meds, and my pharmacist sends me a card basically saying, "Oh, bad vacation. Sorry about that," right? Very unusual. But my relationship there with that pharmacist, and the fact that pharmacist has taken the time to get to know me as an individual, is the reason why I support that business. So whether it's a staff pharmacist working for that pharmacy or the owner of that pharmacy, like in that particular pharmacy, you can't tell the difference, and you should not be able to. So regardless of the environment, the pharmacist has to take, I would argue, an interest in how robust and what a good service they provide to their patients, or they won't have any.
Yeah,
right?
or they won't have any, right? So on that vein, from the college's perspective, David, do you receive complaints from pharmacists about their working conditions, and do they have an expectation that the college is going to deal with that and have their back?
Yeah, so we don't receive complaints that the pharmacist is too busy. The way we come across these is when someone comes before the inquiry committee and there's been a complaint lodged against them by a member of the public. And sometimes we hear them say, well, I didn't have time to do A or B because I was too busy. And so therefore, this is what happened. Right. And so that's kind of how it comes across our desk. It's not so much a pharmacist phoning us up out of the blue saying, hey, my employer's asking too much of me. What do I do? It happens when we have a complaint that comes to the college.
Generally from the public.
From the public.
Yeah. Okay. Well, that certainly makes some sense, I guess. One of the other questions with regards to the two organizations that you represent is, and it sort of comes back to the whole relationship issue, is, how much should the college count on the association's input when it's doing things like looking at potential regulatory changes, updating bylaws, things like that, and vice versa? Should the college count on, should the association count on the college's input when it's developing things like policy statements, for example, on particular issues?
Well, I think our process for any amendments to any bylaws, or legislation, we consult with all stakeholders, and we take that feedback and as very valuable. We want to hear from the people that are actually going to be delivering the services based on the legislation and legislative changes that are being put forward. So there is a consultation process that takes place, and there's public postings, and all that feedback is taken in and considered in developing changes or amendments to any legislation. So I think it's very important, not only for the association, but for the public, for other organizations like the BC Centre for Substance Use or the university. all to provide feedback to help better guide the college in making accurate and informed decisions.
I think we're in a very good place with the college in terms of what really is a loop. So we start by saying, okay, tell us why you're doing this. Like, what's the purpose? What are you trying to fix? And then there's the, have you thought about this? Which is, I think, a role that we play.
Yeah.
And then there's the, so once all of that is incorporated, us being able to be a vehicle to say to members, well, here's what we understand. Here's some of the things we suggested that the college look at, and here's where we're at. So it's kind of, I think, a bit of a loop where, and the starting point for us is to say, well, why are you doing that? Like, what is that about? What motivates that change to that bylaw? And then, because we have our members who are, day to day in the business saying, well, you might not have thought about this, but if you do this, it impacts this, right? And so it's kind of an iterative process. And I think it's worked very well over the last few years.
Yeah. And most recently, we've gone through the process of changing the drug scheduling of liquid codeine preparations. And, there was a number of issues that were coming before the college with regards to forgeries and robberies and putting patients and registrants at risk. And we consulted with all the stakeholders as we made those decisions to move it from Schedule 1 to Schedule 1A, requiring a triplicate or a duplicate prescription pad to be written for it and it to be stored in a time lock safe. And we were seeing an enormous number of forgeries, and of course we were only seeing the forgeries that were badly done, not the ones that were well done. So so all those things contributed to making the decision, and we explained the reasons behind it, and we're fully supported by the stakeholders involved, and I think that change is a very good change, and it comes in effect in January.
So presumably, if you are needing to make some changes that require the government to do something from a legislative perspective, it's easier perhaps to achieve if you have the support and can show the support of a number of other stakeholders like the association.
Oh, for sure. And one of the things we do before we even make a change is we run it by the legislative people in government to say, hey, this is what we're thinking of doing. What do you think? And then we go out and we, get the stakeholder feedback. And for sure, when there's, unanimous support for a change, it's much easier for government to buy in on that, for sure.
So we used the word stakeholders a couple times here. So I'd like to transition the conversation a little bit and move into a little bit of a discussion about your relationships with some other key stakeholders in the healthcare system. And where I'm really going with this is in particular physicians, but we can talk about other stakeholders as well. And so first, from your perspective, David, how's the relationship between the College of Pharmacists and the College of Physicians and Surgeons? And is that an important stakeholder relationship for you to have?
I would say it's a very good relationship, and it's very important. I think our relationships with all the other regulatory bodies are very important. And I can give you an example. The board recently put forward and asked the registrar to remove the restrictions on pharmacists' injection authority. And we put that forward. We were going through all the proper processes, all the right steps. But the ministry was a little concerned about, how the other colleges would feel about this. And so, a number of steps were taken by the ministry, and a group, our committee was formed to look at this. And we had members from the College of Physicians and Surgeons, members from the College of Nursing Professionals, members from the ministry, all at the table. And we had full support from the College of Physicians and Surgeons on removing those restrictions. We had full support from the College of Nurse Practitioners on removing those restrictions. And I think that was a bit of a surprise to the ministry of the support that we had. And I think the basis of that is the relationships that we have with those organizations and how positive they are. So I would say they're very, very important.
That's good to hear. I think one of the things that, in general, the profession doesn't have an awareness of is exactly that, is that you have relationships with other stakeholders, and they're really important. So Geraldine, how about you and the Doctors of BC or the Society of General Practitioners? Are those important relationships, or are there others that are?
I think the working relationship between pharmacists and doctors expresses itself in the field, if I can use that term, right? Every pharmacist has good, productive working relationships with their physicians in different fashions. And you really see that play out in very visible ways in rural communities, right? And
for sure.
You know that, and you will have had that experience too. I think when you get to an organizational level, so everyday pharmacists and physicians, collaborate and cooperate and talk back and forth and solve patient issues. We've now had some moves to create interdisciplinary teams that, outside of hospital settings. Again, in hospitals, this happens every day. So we're now going to have some, urgent care centers in which that's happening. From an organizational perspective, it tends to be issue specific. The doctors of BC have things going on every day and to deal with their members, and so do we. And so we tend to not, we don't have the same opportunities, I don't think, for engagement that the colleges do. So it tends to be issue specific. So I'm thinking of, a drug shortage not so long ago, which would have a patient impact. We got involved with the doctors of BC to talk about that issue. So it's more issue specific, which probably is a shortcoming, but that's generally speaking.
Well,
how it works,
it makes sense though, and there are a lot of issues. But I'm glad you raised the issue of the injection changes with regards to age and stuff, because I think a lot of pharmacists believe, and I think rightly so, that restriction is there in the first place because of some opposition from the physicians when pharmacists were first granted injection authority back in 2009.
Yeah.
And so it's nice to see that there's a relationship that has progressed to a point where there can be dialogue about that, and we can show that the profession has performed admirably as far as injections go, and it's time to move on and take it to the next level for the benefit of the public.
And you need only look at flu as the ultimate example, right? I mean, you go back to when pharmacists were provided injection authority for flu. There were even some pharmacists who weren't sure that was really such a very good idea, right? And didn't really want to do that, right? I didn't get in pharmacy to do that, right?
Yeah.
And you now have, in last year's flu season, like 750,000 people went to a pharmacy and got their flu shot. No one now questions about whether or not that's something that pharmacists can do. And so that success with that and public acceptance, whether it's flu or measles or pneumonia, means that the next incremental move is easier because people have positive experience with doing that.
Okay, so great segue, because you've led me to another topic in terms of this incremental move stuff.
Yeah.
And so we hear a lot from the profession in general about expanding scope, and a lot of pharmacists from an individual perspective.
Yeah.
And we sort of talked about this already a little bit. It was, I want to do more. I want to do what's best for my patient. I want to, make the right decisions. I want to be able to give them all the help that they need to get the maximum benefit from their drug therapy. But how do we address, I'm going to call it one of the elephants in the room. There's always lots with everybody. And for pharmacy, I think that's the issue of a lot of pharmacists are not even close to making use of what they have available to them today. So why are they asking for more?
Yep. Yeah. And that's, we ran an information campaign to remind members of the public about all of the things pharmacists could actually do. Like, did you know that you could get an emergency
I remember
refill?
seeing the ads on TV many
right?
times.
Yeah, we did. And frankly, we ran that as much as a reminder to pharmacists that these were already things that they can and should be doing, right?
Yeah.
And that this was a way for them to interact with their patients and engage and provide a support to their patients that some of their patients might not know about, but that they needed to be reminded to step up and do too. So certainly I'm not shy about reminding pharmacists that they need to do all of those things, because if you go to government and we get these reports that show the number of adaptations, the number of refills, the number of renewals, if those numbers aren't high and across the board, why on earth would anyone entertain giving us authority to do other things? If you're not already doing some of the things that you have authority to do, if I'm making that decision, I say, well, go off and do those things first, right?
Yeah. That makes sense. And I guess from the college's perspective, those things all contribute to potentially better patient care. So
For sure. Yeah.
you support that. and-
Continuity of care.
Yeah.
And, we see that all the time where pharmacists, do an emergency supply or an adaptation or a therapeutic substitution. And yeah.
So, our audience for the podcast may be a national audience. And so, in fact, if you look at the charts that are produced by the Canadian Pharmacists Association or the Canadian Foundation for Pharmacy, they tend to show that British Columbia might be potentially behind the rest of the country in terms of expansion of scope. But one of the things that I've always been aware of and tried to tell people in the profession here is, but everything we have in BC is supported with an economic model. In other words, it's pretty much a payment for every service. Whereas in a lot of other provinces, those services or that scope exists, but it's not supported by an economic model. So it doesn't really happen very often.
Yeah.
Is that your perspective on those things? Do you think?
Yeah, that's how I
fair?
understand it. In some provinces they have prescribing authority, but it's not funded through their provincial health system. So it's private payers or it's out of pocket.
Yeah.
So yeah, I think that's accurate. I think the Alberta model is a little bit different. They do have some public funding that supports their pharmacist prescribing.
There needs to be both. I mean, I have said this for a long time, I'm not shy about saying this, is that you need to make the case for why is it a wise decision to have pharmacists prescribe for a minor ailment, a UTI, or whatever. And if it makes sense to do that and it's in the patient interest in a public payer system, then it makes sense to pay for it.
So to that end, thinking about the situations where the public payer isn't going to pay for that, will the public pay out of their own pocket for that stuff? Do you think that we're at a position where we've created enough trust with the public in the quality of service that we're providing? If we go back to the beginning of the conversation around having that relationship and that interaction with every patient every time at the counter, are we there where the public will reach into their wallet and pay most of the time for the things that aren't insured?
I think in a Canadian context, we have little bits of experience in that regard. So in Nova Scotia, when they introduced prescribing authority for UTIs, that was a private pay. And women lined up and said, I'm going to pay I don't remember what the dollar value was, but paid for that service, which ultimately became, publicly covered. That similar experience in Saskatchewan, again, with the same issue of prescribing for that particular minor ailment. In BC, our best evidence is around pharmacogenomic testing on the PGX testing offering that we have. And people are, not thousands and thousands of them, but frankly, in greater numbers than you might expect in a public pay system, lining up to say that is information that's important for me, it's important for my pharmacist, it's important for my prescriber, and if it's not covered, I'm going to pay it. So I think in the Canadian landscape where we are accustomed to showing up and getting care and getting our medications, that there's going to be limited opportunities, but there's probably some.
Yeah, I agree, and I've always maintained that if there's enough value in what you're, what you're providing to the patient, they are going to be willing to reach into their pocket. Unfortunately, from my perspective, pharmacists have a terrible history in that regard. They can't seem to.
Easy to ask for the order.
They have difficulty looking Mrs. Smith in the face and saying that'll be $40.
Yeah.
Thank you very much. And the problem with that is you've set a precedent and created an expectation that is supported by a lot of other behavior that we have within our healthcare system, that healthcare is free in Canada, and it's not.
Yeah.
And I think people really believe that, especially if their employer pays their health premiums, whatever those might be for private or public healthcare, depending on where they live. And so they believe that that it's free, and really that's not the case. But I've had very positive experiences of patients saying, "Yeah, I will pay for that." Now there's a mindset out there that on the part of some piece of the public, that the more you ask for, as long as you are delivering value, the better the service might be. And I've seen a situation where one pharmacy and another pharmacy were offering the same service to the same people in the same venue. One was doing it for free and one was charging $40 for the service. And the $40 pharmacy had people who actually had the service at the free pharmacy and then came and paid $40 for it and said, well, it's $40, it must be better. So, yeah, I guess we have to.
You get what you pay for. Is the same
It's
thing?
kind of I think that's the thinking on that part. How do you respond, Geraldine, to criticisms on the part of some of your members that the association caters to corporate pharmacy, and that corporate pharmacy really has the rule of the roost at the association? I think it's a misconception, but I hear that criticism.
I'm sure you do, and as I say, I think the model of having a membership base that includes the place that the professionals and the place that they go to work every day is the one that is going to be best suited to advocate to any payer. So when I go and meet with the ADM in Victoria, he knows that my membership is not only pharmacists, individual practicing pharmacists, but it's all pharmacy in all of its incarnations across the province, community pharmacies. So if they're looking for a perspective on what pharmacy thinks, community pharmacy thinks, we're a pretty good place to come, right? I think we are well equipped to engage with individual members. We do ongoing kind of work with them in terms of membership, et cetera. But there are some issues. If you're not happy with the shifts that you're working at a particular pharmacy, I can't do anything for you on that, and nor should I, right? So.
Yeah, fair enough. I think part of it's generational too, and you've got pharmacists that are members and registrants from decades apart, right? And there's people from my generation, and there's the new millennials and generation X and Z or whatever other letter. I don't know what those things mean, really, honestly. But,
I know I've lost.
But anyway.
But I should say that it is our job at the association, my job, and everybody else on the team there, to demonstrate the same value that I'm saying that a pharmacist needs to demonstrate to their patient. I better be sure that when Joe, the pharmacist in Dawson Creek, calls with a question and an inquiry or needs something for us, that they get the information that they need in the same way that if the pharmacy in Comox calls and they need information, that they're getting what they need from us. So it's up to me to prove, the value of the organization from those day-to-day encounters to what we're able to do by raising the profile of the profession and the business in the province. And if I can't do that, then neither of them should be our member.
Yeah, and I think clearly, the association in BC is probably doing, from my perspective at least, quite a good job at that, because it's my understanding that as a voluntary membership organization, you have one of the highest per capita rates of membership of any of the associations across the country. Yeah. So I think people must see value. And we, in the past, David, you and I have talked about the fact that, people in the profession see the college quite often as a resource. And when they have issues and things that they don't understand or issues related to practice, quite often they'll lean on the college from a resource perspective as well. I know from my own personal experience, there's times when the college will refer somebody to the association and vice versa. Yeah. And so I think that's, for sure a positive thing from the relationship perspective as well. Yeah. One of the criticisms I've heard with regards to the college, and I'm a messenger from the profession here for you, is that the college is a little bureaucratic in the sense of it seems to have a lot of staff for what people see as what it provides from a service perspective. Do you have any comment about that, or
Sure,
is it just a misunderstanding on the part of what the college does, so people don't know why you need all those people?
No, and you know what? As you know, I practiced for 25 years in community pharmacy before becoming the deputy registrar at the college, and I would be lying to you if I didn't have those questions myself when I was a community pharmacist. Being on the other side of the table, it's a group of very hardworking and passionate people at the college, and I was so impressed at the quality of work that is done there, and the people that are doing that work. And there probably does seem to be a lot of people, but we have some programs that are very labor intensive. Our practice review program, very unique in the country. We have, a practice support phone line where any pharmacist can phone in at any time, and we'll get back to you within 24 hours. We have our complaints department. Like I mentioned in a previous episode, our last fiscal we had 794 complaints that came through, right? And we have to address those. So, we had that discussion around how the complaints process works and how time consuming it is and how much more involved lawyers are getting in the process. And so, you need staff to support that, even the interaction, our interface with our registrants, our website, our license and registration, there's a whole IT support team behind that to make sure all those functions are working. And we have periods of time where we have to shut the system down to do upgrades and updates on software. So, there's a whole group of people that are in there. And, I haven't even touched on our communications or our legislation departments who are very instrumental in moving some of our projects forward. It's a big team, but like I said, I've been thoroughly impressed in the over 2.5 years there, actually 3 years now, that I've been at the college with the quality of people and the work that they perform.
Well, that's good to hear, and I'm sure that all the registrants are going to be happy to hear that their registration fees are being put to good use, because they complain about it all the time. But that's the nature of things. Everybody complains about what fees cost and that sort of stuff. So we're going to have to wrap it up for today, but I want to thank both of you very much for joining me here on our podcast today. And I hope that our viewers and listeners find it educational. And we look forward to having both of you back on a future episode to discuss maybe some other topics or things that are more specific, or some future things that will be happening in the profession. And so we'll continue to stay engaged. So thanks again.
Thanks for having us.
So thanks for joining us on our podcast, and we look forward to seeing you again on our next episode.